shoot.
Wonderful viewers, you're very much welcome to this yet another interview, and we are glad that this time round we have the VIP show dedicated specifically for your health. If you are a woman or you have a woman in your house and the whole gender or the whole female gender, this show is very important and candid for you. Matters of fibroids in this country, Uganda, and world over, fibroids have become a huge tragedy, and we are here specifically to discuss and see how we can go about it, more so for our women, for the lives of our mothers, for the lives of our wives, for the lives of our sisters. And today in studio we have a doctor with us, Dr. ELEANOR Nakintu, coming right from Midland Health, is it?
Healthcare. Yes,
Midland Healthcare. She will be talking to us and digesting this whole fibroids issue. Doctor, you are welcome.
Thank you.
You could say hi, you could greet our viewers, and then we dive into this discussion.
Yes, thank you very much for having me here. It's such a pleasure, especially talking about women's health. Once again, my name is Nakintu ELEANOR. I'm a specialist obstetrician, gynecologist, and also the medical director for Midland Healthcare. And my passion is in women's health.
Your passion is in women's health. What a great time to have you. Now that we have someone who is passionate about women's health, and we have a huge issue, a huge discussion going on about fibroids in this country, well, we have the right person, but let's first get the right sponsor for this show. Shortly we will get.
Mu mutima gwa Uganda mulimu ekimera ekyenjawulo era nga kijiddwamu omutindo ogusukkulumye. Engano ya jiko nga ekolebwa ab'amaganjo grain millers. Kola ebyokulya eby'omulembe nga okozesa jiko owoomerwe ne famiri yo ne ku mikolo gyo. Yimusa omutindo gw'enfumba yo oyimuse essanyu lyo nga okozesa engano ya jiko ekolebwa ab'amaganjo grain millers. Engano ya jiko evaamu ebyokulya ebiwooma nga byagalwa, woomerwa akaseera konna nga okozesa engano ya jiko. Maganjo grain millers, feeding nations.
Maganjo Grain Millers Feeding Nations is our greatest sponsor. You can get yourself a jiko somewhere, and that's a wonderful route for all the bakers. Now, if you are a baker, you want to make some cool chapati, some nice mandazi, yeah, Maganjo Grain Millers got you all these products, the best wheat, ladies and gentlemen. Now, let's get back to matters health this afternoon. And first of all, before we dive into the deeper discussion about fibroids, tell us about Midland Healthcare. What do you know?
Okay, thank you very much.
I know you do not advertise.
Yeah, we don't, but we talk about them.
Okay.
Well, Midland Healthcare is a facility located in Kawempe, Tula Road, and I am the director. We have a variety of cases that we handle. First, we have a very, very busy outpatient department. We have pediatricians. We have physicians. We have a well-stocked laboratory. We also have a dental unit. We have an operating theater. So it's a very busy facility. And then myself as the obstetrician and gynecologist for the facility.
You need to drive us a little bit slow. Some of us are historians, pastors. We don't understand some of these terms.
Okay. So myself as, when we talk about obstetrics, I hope you hear them so many times. Obstetrics, gynecology. Most of them call them gynas in simple language. So these are doctors. We are doctors who are specialized in women's health. We have finished our bachelor's and then we have mastered in women's health.
Okay.
But when we talk about obstetrics is pregnancy, antenatal, anything to do with obstetrics. Okay. When we talk about gynecology, is anything related to diseases in the female, right from birth up to probably the time of death. that is not related to pregnancy. For example, infertility, fibroids, endometriosis, adenomyosis, all those cases, any other cancers, everything is in gynecology. So that is what we do at Midland Healthcare. We also have a urologist who takes care of men's health. So it is a very busy facility for all your healthcare. I was about to ask
you about the gender balance of your services, but good you have
Yes, thank you.
You have something for us. I think, would someone be right to say fibroid and prostate cancer are the opposite of each other?
Wow, what's an interesting question. Actually, they are not the opposite of each other because prostate, as you have mentioned, prostate is a cancer.
Prostate is a cancer.
Yes, fibroids are not cancerous. Fibroids is not a cancer. Having talked about prostate cancer, I wish to pass on information to all our women who are listening to us. We have a specialized set of doctors who are coming in from Manipal hospitals, that is in India. They are oncologists. They work with cancers. So, but specifically for women's cancers. So they are coming to Uganda. They are coming to Midland Healthcare on the 5th of June and on the 6th of June. Do you have a family history of breast cancer? Has your mother or relative died of cervical cancer, breast cancer, uterine cancer, abdominal cancers, and you are a woman? Or you have a mother who has had those cancers? Have you screened for cervical cancer and you're not comfortable with the results? We have a team coming in on Midland Healthcare, and they are specifically oncology related, and those are the services that we are going to provide to all our women. Yes.
So it's some sort of medical camp, or what is it?
Yes, it is a cancer camp. Reproductive cancers, yes.
Reproductive cancer camp.
Yes.
Okay, so this is mostly targeting women?
Mostly targeting women.
How do we register? How do we be part?
So being part, you just call and we book a slot for you because they have only 2 days.
2 days?
Yes.
Okay. That's daytime, and then we get back home.
Yes,
we come back
and
the
then the following day.
The following day. Registration fees?
Registration fee is free. There is no fees for registration.
Free?
Yes.
Okay.
Yeah. You just book your slot, and then we shall be giving you more details on what to do.
Do you have any cancer challenges as a woman? Now there's an opportunity for you to come and interact with specialists, doctors of this field. Breast cancer, what other cancers do you say?
Cervical cancer, endometrial cancer, uterine cancer. Yes, any cancers in the reproductive, especially if you are a woman and you have history in your family, because we know some of these things run in families. So what we want is early diagnosis. We do not want a situation whereby, oh, I didn't know. But if you have a positive family history, I would really recommend you to come and meet the specialist and let them take us through what we have to do so that you can be able to save your life and the life of your people.
Wonderful. Yeah. Thank you, Midland Healthcare, for that opportunity, and as well as advocacy and awareness about the different cancers. We hope one day you will prepare one for the men. We have a lot going on with prostate cancer.
Yeah, sure.
My dad has been had cancer, has been battling with cancer for the last 5 years. I think we've been good attendants of Mulago Cancer Institute for the last 5 years, but God's grace has been with us. Now let's go to matters to do with fibroids. What are fibroids?
Okay, thank you very much. That's something that I always expect, especially when you tell someone, oh, we have fibroids. Then they ask you, what is this? What are you talking about? I think for the women, and men, of course.
Let me just give a little background of why we're having this discussion. Now, last week, we lost and buried a young woman, such a leader that we all loved, the woman representative for Kalangala district, the late Honorable Nachimuli Helen. We lost her to fibroids, And according to the news and all the reports that we have gathered as media, we understand that fibroids costed us that life. It is upon this that we want to discuss and understand, how do we get rid of this? How do we fight fibroids? What are the signs? How do we go about this whole thing? So I think now the people understand why we're having this discussion. Now let's get to understand, what is this monster that we are attacked with called fibroids?
Okay. So first and foremost, I want to pass on my condolences to the family and all the people of Kalangala and friends to our late MP. That was such a sad story. It was such a tragedy. But it is one of the many.
One of the many.
It is one of the many. And
she's just popular and in the eyes of many, but there are those that are dying unknowingly.
Yes.
That we do not know about.
Yes.
Okay.
Yeah. So fibroids are masses. I'm going to try and use simple language. They are masses, or those who understand the word tumor. They are masses that grow in the uterus. They are not cancerous. So they can be as small as a fruit. They can be as big as a baby. Someone can act like they are pregnant and if they have fibroids. And they come from, it is basically muscle. So it is muscle of the uterus that is overgrowing, and it can start as just a simple growth, then it continues, it piles muscle, it can pile other structures on it, for example collagen, it can, but the actual swelling of a fibroid is a muscle of the uterus, and it should be innocent. It is not cancerous at all.
Fibroids specifically attack the uterus and not any other body part.
Yes, when we talk about fibroids, that is the general language, but in the medical language, it is a leiomyoma, meaning it is a muscle of the uterus.
Muscle of the uterus.
Yes, so since the uterus has different shapes, it can come from this side and it enters where the ovaries are, but it has still come from the muscle of the uterus. Yes, it has to be a uterine origin. Yes.
Okay. You now understand what we are dealing with and what it attacks. Your uterus could be at the risk of getting fibroids. I have some complications. How do I tell that I am actually becoming a candidate of fibroids?
I think before you even think of, or perhaps I'm going to have fibroids, or maybe I have fibroids. Because remember that fibroids, not all fibroids are symptomatic. People live with fibroids for a long time.
Not all fibroids are symptomatic.
Yes.
So that means you may have them unknowingly.
You may have them and you may die with them when you don't even know.
You don't even.
Yes. Because I have said it can be as small as a small seed, or it can be as big as a baby. Yes. We have some pictures. Okay. So if you look at, for example, if you look at the image that is the first image, it's showing you the different locations of the fibroids. So depending on the location, depending on the size, depending on what you are feeling, then you know, oh, I have to go in for a checkup. Okay. But the symptoms may range, and this is where the story gets interesting, Joshua, because most women, I'll give you a very small example. They will come to me and say, Doctor, I am suffering from UTIs. I keep getting UTIs. Yes, UTI, urinary tract infection. So I go to the toilet more often. I have treated with antibiotics. I have got all kinds of medications, but they are not going. Okay. As simple as that. We could be dealing with a fibroid. Okay. Yes. So the symptoms or how it presents depends on the size, the location where it is. Okay. Some people will have those frequent UTIs because the uterus will now be bulky and it is leaning on the bladder. So even a very small quantity of urine, she'll feel like it is full. I have to run to the toilet. And what happens when they go to the doctor? Urine check, 1+ antibiotics, but you have not dealt with the actual problem. Some women will just say, I feel heavy. Like I feel like I'm carrying something inside me. And then others will complain of discharges. Okay? So many women have discharges, and I keep telling them not every discharge. A discharge is any liquid that is coming from the vagina. That's my language. So I hope it's fine with you.
It's very fine.
So
it's very fine.
Every woman should have a discharge. Not all discharges are abnormal.
Okay.
When you keep getting those discharges, you need to check in. Some of them can be foul smelling. Some of them can have different colors. Some of them can be watery. Some of them you will treat and they will keep coming back. You treat and they keep coming back. You could be dealing with a fibroid that has changed because they change in their structure.
Those are the symptoms, those are the signs that you could use to detect that you may have the fibroids.
The most important is bleeding.
Bleeding?
Yes.
So
periods that are very heavy, periods that are lasting longer than they should, please come and check in with your gynecologist. Chances are that you're having fibroids because they are masses, like I said, and they have very big blood vessels. So every time you're in your period, you have the normal period will come. These blood vessels that are on the fibroids will also tear down and they will bleed. They will bleed 2 weeks and the bleeding will be so heavy.
These are signs. Now, what are the causes? How do we get there to the signs?
What causes fibroids? Is that the question?
Yes. What causes fibroids?
What causes fibroids? So there is no single cause. I am not going to say there is this virus that comes and it causes fibroids. However, there are a number of things that have been researched and have been related to the development of fibroids. Okay? And if you can allow me to go through them.
Yeah, we have our local stories, the jazz we have heard from the streets of what could be causing fibroids. Some people think it is limited sex. Some people think it is little or no childbirth. So the little sex that I have had or not had, could it cause fibroids?
Interesting. Interesting. That's a very difficult one. However, scientifically, it has no relation.
No relation
to fibroids. Why?
Fibroids have no relation to sex, to the amount of sex I've had.
No, they don't have any relation to that.
Okay.
However, they are hormone controlled. They are controlled by hormones. Let me start from there. Okay. As a woman, you have your hormones, you have estrogen, you have progesterone, you have those hormones that make you a woman, okay? Now, that is the food of the fibroids, okay? So I'm just trying to answer the other myth that you told me about delayed childbirth. So you may have a family predisposition, perhaps in your mother, your sister, or your grandmother. They had fibroids, and here you are. You have a family predisposition. So the predisposition is...
Let's make the English much more simple.
It's like inclination. It is in your family. You are at a higher risk of getting it. So
there's something related to the history of our family.
Yes.
If I've had someone in our family who had fibroids before, it is possible that this could be replicated or could attack much more members.
Yes, so it has a genetic component.
Okay.
Yeah, it has a genetic component. I wouldn't even say that someone who has had fibroids before. You can all have them, like sisters. Yeah.
Okay.
You can have them. You're living with them. You're managing them. And your sisters, but you're living with them. So it has a genetic, you refuse me to use predisposition. It has a genetic connection. Genetic connection in the family.
So let's interrogate this genetic thing. If it is genetic, And is it possible that someone would actually suffer and get the heavy attacks of these fibroids at an early age?
Yes, 100%. We have seen fibroids in young girls.
Young girls?
Yeah, we've seen fibroids
as
around...
young as 5? Or?
No, not 5.
Okay.
It starts... Remember, I told you the bottom line, it is hormone-driven. As long as now I'm into my adolescence, the hormones, I mean, my active reproductive years, okay, it is those hormones that feed the fibroids. Okay? So the hormones enable them to grow. Remember, already I have a genetic inclination. Okay? So the hormones will enable the fibroids to grow.
How do hormones feed the fibroids? I want to understand the relationship between hormones and fibroids.
Okay, so there are so many studies that have been done. As you age, you're going towards menopause. Even if you have that fibroid, it will shrink because you're getting out of your active reproductive years. So what makes you reproductive are the hormones. So every time you have a long time exposure to those hormones, they enable the fibroids to grow. That is why you said in the beginning that it is related to a delay in childbirth. Because you're overexposing your uterine muscle to those hormones without interruption. Okay? So it is too much exposure to those hormones with no interruption. Pregnancy interrupts them.
I seem to be getting to... so if I over-interrupt the hormones, am I preventing?
You are not, because when...
I guess you understand what I mean by over-interrupting the hormones.
Yes. When we talk about fibroids, like I said, there is no single cause. All these have been, there are studies that have been done and they are related. For instance, you are going to find a woman who has delivered 9 children and she has fibroids.
Somebody has 9 children and they will still get fibroids.
Yes. Or they had them, but they were small. Like I said, it depends on the size and the position where they are for them to interrupt you. Yes. So continuous interruption per se may not be entirely protective. However, non-interruption may cause them.
I have issues with medics. You are never specific. It's like you don't want to be held accountable for some of these things. Why don't you be specific for at least today and say,
because with
we
fibroids,
need to have enough interruptions?
Yeah. No. I won't say that. I won't say that. With fibroids, by the way, with fibroids, like I said, there is no specific cause. I haven't even finished with the risks. For example, a lack of vitamin D.
Lack of vitamin D.
Vitamin D has been studied, especially in the Western countries. Oh, I forgot to say that 70 to 80% of African women will be diagnosed with fibroids.
You're scaring us.
Yes. So it is common. They'll be diagnosed with fibroids before they even hit menopause. However, not all of us are going to show the symptoms. So I will live with my... that's why I'm not being very specific, because this is an interesting topic. Dangerous, it has both extremes. Dangerous, but it cannot show, and yet it can be deadly. So we are trying to make sure that this person who has fibroids, and they are not going to manifest as fibroids until probably they leave the world, has understood that there is a possibility of them manifesting. And then this one who has them should be aware that anything can happen to me at any time. So lack of vitamin D has also been documented as a cause for fibroids. We've talked about genetic factors. We've talked about delayed overexposure to hormones, that is delayed childbirth. Then we talk about vitamin D deficiency. But above all, most of all, it is the genetic factors.
Genetic factors.
The family related.
The most common is genetic factors.
That has been widely studied, and it is the most common.
So if you say genetic factors are the most common, therefore, if I am choosing a partner, for example, there's a lady called Peace or whatever that I've chosen as a partner, Should it be mandatory, or should it be advisable that one of the medical tests we have to do is finding out whether they have some sort of history of fibroids?
Well, I like that question. However, sometimes you will not know, because Peace may have a mother who had fibroids which were asymptomatic. They had no symptoms at all, and she didn't know. Yes.
Don't you have tests for fibroids?
They're there, but you are not going to screen bring your sister, your mother, your relative, your auntie, all of them, and I do scans on them before you go into marriage, before you say yes to Joshua.
Oh,
yeah.
Okay. Right. I know you have now understood that there's genetics involved, there's vitamin B involved, D involved, and yes, some sort of, what were they? Hormonal exposure. We need to dissect that a little bit more to be understood very well. But let's have a break, and we are getting back. We still are talking matters health and trying to discover and discuss fibroids.
Mu mutima gwa Uganda mulimu ekimera eky'enjawulo era nga kijiddwamu omutindo ogusukkulumye. Engano ya Jiko nga ekolebwa ab'amaganjo grain millers. Kola ebyokulya eby'omulembe nga okozesa Jiko, owoomerwe ne famiri yo ne ku mikolo gyo. Yimusa omutindo gw'enfumba yo, oyimuse essanyu lyo nga okozesa engano ya Jiko. Ekolebwa ab'amaganjo grain millers. Engano ya Jiko evaamu ebyokulya ebiwooma nga byagalwa, woomerwa akaseera konna nga okozesa engano ya Jiko. Maganjo grain millers, feeding nations. Mu mutima gwa Uganda mulimu ekimera eky'enjawulo era nga kijiddwamu omutindo ogusukkulumye. Engano ya Jiko nga ekolebwa ab'amaganjo grain millers. Kola ebyokulya eby'omulembe nga okozesa Jiko, owoomerwe ne famiri yo ne ku mikolo gyo. Yimusa omutindo gw'enfumba yo, oyimuse essanyu lyo nga okozesa engano ya Jiko. Ekolebwa ab'amaganjo grain millers. Engano ya Jiko evaamu ebyokulya ebiwooma nga byagalwa, woomerwa akaseera konna nga okozesa engano ya Jiko. Maganjo grain millers, feeding nations. Mu mutima gwa Uganda.
Maganjo Grain Millers Feeding Nations is a wonderful sponsor that we have on all our shows, by the way. We want to appreciate them for being that generous, and as well as doing a lot in the business world, and of course producing the wonderful wheat Jiko, among the many other products. So if you do home bakery, you do entrepreneur bakery, you do mandazi, you do whatever that requires wheat, please make it a point to look for Jiko in all supermarkets, even those abroad. We understand that this show goes as far as unlimited. So if you are in Canada, there's still some Jiko there. Just check around. You will find any product that has Maganjo Grain Millers is very authentic and wonderful, as and stamped by LC Africa. Now at LC Africa, yes, we're streaming live on TikTok. Please, those who are watching on TikTok, we say hi to you, we greet you, we love you. Please make it a point to also move to our YouTube channel, which is LC Africa, on as well on Facebook, LC Africa, on all social media platforms. We are LC Africa. Sometimes you might find these clips on my personal TikTok account, which is Joshua at LC Africa. So you will be getting all this information. Please subscribe to ensure that you catch up with the many other episodes that we might have. We are the Content Factory. We have so much services for you. We have studio space. You can come and rent this studio and then record your own content. You can do your documentaries with us. All that the cameras do, we do. Yeah, so we're still discussing matters to do with fibroids. This matter has come up courtesy of the incident we had last week of losing a whole member of parliament. But I know they are not new. When did you first hear about fibroids?
I first heard about fibroids when I was in school.
Okay.
when I was in school, and that is, let's say, 20 years ago.
Mm.
When I was in medical school, yes, that's when I heard about fibroids.
Okay.
Yeah.
So you heard about fibroids in school, but experiencing someone who has fibroids, let's say, the first woman that ever came to you saying, "Oh, I have this complication."
What is interesting, I would say that in my daily practice at Midland Healthcare, at least on average in a month, I'll say like 20.
On average, in a month, you will get 20
I'll say 20
who have signs.
fibroids.
Okay.
Out of those 20, I would say 30% of them come when they don't know that they have fibroids. It's just something that you discover together. Good enough, our radiology staff, you do the imaging while the patient is looking, so they show you what you have. So it's relatively common. However, the interesting thing is, by the time you realize you have fibroids, you don't start by, I have fibroids.
Okay.
No, that's not how it starts. Some come, they cannot conceive, failure to conceive, I cannot get pregnant.
So if my wife or my girlfriend ever fails to get pregnant, I've been with her for some 2 to 3 years, I've tried all the styles, things are not working out, she could be having fibroids.
It's possible, and that takes me back to the location.
Okay.
The location of the fibroid. You can actually have 6 children when you have fibroids. Not you, okay, because you're a man.
Okay.
A woman. You can have your children. 6 of them or more when you have fibroids, depending on where they are.
Where they are.
Yeah, I showed you an image of the different locations of the fibroids, okay? So,
are you saying they block penetration?
depending on where they are. I wish I could have a look at that. Right away from the opening of the uterus, cervix here, you can actually have a fibroid there.
Okay.
So even if you ejaculate, if you want to ejaculate 1,000 times, those sperms will not pass. They will not go.
They block, fibroids could block sperms.
They could block sperms. They can block the egg from coming from the fallopian tube. So position is very critical. Position of the fibroid is very critical. So they can block the egg from coming. They can actually, so assuming the sperm goes through and they fertilize, they can block implantation. Implantation is, they can block where the baby is going to sit. And then those are the women who come, I have abortions every time. That's what I told you. They're not going to come, I have fibroids, Dr. Elena. No. That is why it is very important for all our viewers here, the women, seek help from a gynecologist, seek help from your obstetrician. Do not self-medicate. Oh, I'll go to this clinic and do a scan, but the scan is normal. My periods are normal. I am not conceiving it. Or I'm having abortions. Every time I conceive, the baby comes out. The baby could come and sit on a fibroid. After 1 month, they're out.
Why don't we just pray about them for them and they disappear? Do prayers work on fibroids?
Prayer is a different activity. Action is also different. Seek help. Come to a gynecologist that you trust. In my experience with the women, I have found that many women are suffering in silence, and they are looking for that trusted person they can come to and explain. Because the women, you'll forgive me for this, when they come to the office, they have a problem that is underlying, but that is not what they start with.
By the way, let me ask. When women come to your office or to attend to a gynecologist and they have all these complications, are they confident enough to say, oh, this is the matter, I have a lot of science going on?
I would say 50% of them are, and the other 50% will actually finish everything without even looking at you face to face. And they will say everything, you'll finish the exam without even them looking at you. So they have underlying issues. So what I was saying is, you have a discharge, you are failing to conceive, you have bleeding that is heavy, that is very painful, you're having frequent UTIs, you're feeling heaviness in your abdomen, say I cannot walk, or when I go to the toilet, I feel like I am pushing something out. You're having pain when you're having sex. So they will not come to you, I have fibroids, but everything I have mentioned, habitual abortions.
Sex is very painful to you.
Yes.
It
could be.
Could be having
fibroids.
some fibroids.
Yes.
Bad news to you. What do we do?
So how do we manage them? Number one is to seek help. Do not sit with your problems at home. Find a trusted person you can talk to. Women, undressing is not something simple.
Undressing before guiding whatever.
Before anyone, it's not simple. Okay, especially when you have something that you think is not normal to you. So find someone who you can feel free with. Please check me. I think I have this issue, and that has helped many women. So come to a gynecologist. Let us take you through. Now, evaluation and management of fibroids is individualized. I am not going to say go for surgery. No. I'm not going to say go for medication. No, it is individualized. There are all those different treatment options. One will come, they want a baby, okay? But the fibroid is in the way.
There's something you said, that fibroids can be as small as unnoticed and can be as big as a fruit. I don't know which fruit you referred to, with a watermelon or a baby. What determines the size?
Very many factors again. The time frame. How long have you had that fibroid?
Okay.
You may have had those symptoms. Maybe, let's say, in senior 6 or first year of university, you have those small symptoms. I'm bleeding, it's painful, it's increasing. Now I have a discharge, I've treated, it's not going, you know, and it is growing. You have never had a scan. You've never done a transvaginal scan or an abdominal scan. So that also determines, and also fear. I've had so many women who have had those fibroids and they say, I'm going to use herbal. Lo and behold, 5 years, 6 years, no change. By the time you come, you're almost pregnant. Okay? So there is fear of surgery, fear of medication, lack of money, lack of partner support. Okay? Lack of partner support can also can also make them fear, because if we are married and you're supporting me, I can easily tell you, know what, I am not comfortable with this, I feel this, go to the health facility. But I can also come to you and you say, I'm going to get another wife. So
before we get to partner support, you see some of these watching us only want the support in chips and chicken. I don't say fibroids, but let's first understand. What level does it get to surgery?
Okay. Again, like I said, management of fibroids through surgery, like you ask, is individualized. What are the symptoms you're having? Where is that fibroid?
Okay.
The fibroid may be outside the uterus. The fibroid may be inside the uterus and you are bleeding a lot. What are your fertility desires? You may have that kind of fibroid, but you already have 3 or 4 children. Then I'll say, okay, for now, let us not. We can do surgery, or let us not do surgery, or you may not have any child. They say, before we even go there, let us first give you this treatment option. Let us first give you their injections that we give that help to shrink, to help
we can shrink the fibroids?
Yeah, we shrink them with the subdermal. We put under the skin implants or some injections that shrink them. Why do we shrink them? Not for healing, by the way. Because we are planning for surgery and we want the surgery to be smooth, because they can bleed to death. Okay? And for the women out there, when you have planned for surgery, you don't just walk in and say, Dr. Elena, I'm here. Operate me. That is deadly.
Oh. So, yes, let's understand. The woman member of parliament drove herself to the hospital for surgery. And then she got to that whatever surgical bed. Do they call it that? How does this happen? I thought somebody who is ready for surgery, who is at the level of surgery, should be brought in an ambulance and all that kind of thing.
Yes, thank you for that question. I must put a disclaimer that I don't know exactly what happened. The story is as plain as you have put it. Driving into the hospital and then not being able to wake up from surgery. I don't know exactly what happened, but this is what I know. Yes, you can drive yourself to hospital. However, there is no minor procedure that say this minor procedure won't kill you. Even circumcision, they die.
Circumcision can...
Even a simple lump here, removing it, as soon as... And surgery cannot be the only one that has killed you. Even anesthesia itself It could have been anesthesia complication, and then for others we'll understand surgery. So you have to be in hospital. The reason why they say, come the day before. I have to take off your blood because fibroids can bleed. They have big blood vessels.
Okay.
I had some images to show you. They have big blood vessels. So you come before, take off your blood, keep it, do cross-matching, save some blood for you, sleep, spend the night in the hospital.
Isn't there a means of avoiding the overbleeding in the process of operating the fibroid?
There are so many things that can be done even before the operation, okay? But like I said, every individual, everybody is different. And there are also actually other methods where you don't even operate. You just stop the blood supply, cut off the blood supply from the side, from the fibroids. It's called uterine artery embolization, and hospitals now do that. That is very much available, okay? So if you have finished, I would prefer for those who have finished their fertility desires, so you can go for uterine artery embolization. They just stop the blood supply. I'm doing two sides because the uterus has two sides.
They are two sides.
Stop this side, and they stop feeding the fibroid, and they will shrink, okay? Without surgery. But it also depends on the size. That is why I repeat, it is individualized, depending on your desires, depending on the symptoms and where the fibroid is and what you hope to achieve and your health. People who are massive in weight, those who are obese, by the way, obesity, fats produce estrogen. Remember, we talked about estrogen as as something that can make them. So those ones also have fibroids. And by the way, sometimes you can operate. You can come with a scan. The scan has shown you 3 or 4, and you come out with over 40 fibroids from that uterus. So that is why I want to say it is individualized. Before you go in for surgery, there is no minor procedure. Any surgery can kill, even if it is actually even a tooth extraction. You've had people. I've just gone for a tooth extraction. Now they're in hospital. Fever, the jaw is swollen. There is nothing minor.
Let's talk about contraceptives. Are they contraceptives? These birth control methods. There's a lot of ladies at universities. These women emancipation people, these who don't want to get married so early. You are taking contraceptives, you are using all those childbirth and pregnancy control methods. Are they living in huge danger for fibroids?
Thank you very much for that question. I want to say that actually women who use contraceptives, most contraceptives have a protective role.
Contraceptives have a protective role?
Yes. On
against fibroids.
Yes.
How?
They create a hormonal environment that is balanced.
Okay.
Yes. So you'll find out even sometimes when we are treating them, we are treating some women because we have so many treatment options. But it is individualized. You see that someone you have talked through and some we have to give combined oral contraceptives. And you say, let us first go on this to probably reduce the too much, the heavy periods, the too much bleeding, so they can be protective. That is how interesting fibroids are. And actually, as I keep telling you, women's health is real. At Midland Healthcare, it is real. We have seen these things. So they can treat.
I feel shy to ask whether fibroids are sexually transmitted.
No, because they don't have a virus or a bacteria. It is hormonal, it is genetic, okay? It is hormonal, it's genetic, but there is an important role that I don't want us to forget.
Which one?
Yeah, as a Seventh-day Adventist, it is very rare to go to a gynecologist who will tell you about nutrition. But I make sure that all my patients, I want to tell you, dear women, the role of nutrition in fibroids. We already mentioned vitamin D, okay? But also your gut, your gut intestines have those normal bacteria, abnormal bacteria, that pH that is balancing. It is responsible for balancing out estrogen and progesterone. So nutrition. And you can research about it, by the way. Many papers have come out. Nutrition is a key role.
So is there a food that I can eat and it exposes me to easy contraction of fibroids, or it prevents, or...
I think the key here that we can go with is balancing. Balance your gut, your gut microbes, or balance your digestion. Too much excessive caffeine, alcohol, too much fat. Get your nutrition in order. It may not be entirely 100% preventative, but like I said, individualized management, it can prevent you from having full-blown symptoms of fibroids or even developing those bad symptoms of fibroids.
Okay.
Yeah.
Fibroids seem to be a women thing, but what can men do?
Okay, that's interesting. Number one is to, men are very important. They are our bosses, they are our husbands, they are our brothers. So every man in your capacity, you can do something. You are a boss, you're working with females, she is bleeding, she can spend a day without coming, she comes in when she's white, you see that her face is now pale, talk to them, because some of them fear.
So if I find out the reception, I'm like, you look like you have some, did you?
No, you inquire, not really fibroids, but they may be having something. Encourage them to seek help.
Okay.
You're a husband at home, encourage your wife to seek help. Okay? You're a husband, you see that she has that discharge, it is foul smelling, and you just continue having sex. She gets that treatment, you say, no, for me, I'm fine, you don't get that treatment. There's a lot you can do. You're a brother, you have a sister who is having symptoms, talk to her. You can be the person, you can be the only person who is going to encourage her. Okay, you're an uncle, you're a guardian. Men can do a lot. Plus, of course, helping us financially. That's the most important thing. You give us the money, you take us to the hospital, we add on to what we have, and then, yeah, we shall move well.
We shall move well.
Yes.
Okay. Last words, more so in line with advocacy for how to go about the fibroids. I don't know how you would summarize. We seem to be debunking the fake news that little or enough sex has nothing much to do with fibroids. Should we quote that right?
Yes. I agree.
You see, you discussed and he did a lot in hormonal imbalance, whatever, but I want some clarity as we end.
Because sex is not going to give me the female hormones. They are inborn. They are intrinsic. They are within me. They are from my ovaries, which you don't give me. They are coming from my brain. There's a communication between my brain, my uterus, my ovaries, and that has nothing to do with sex.
Single mothers should have no fear.
No. For the women out there, please do not fear. If you've been told that you have fibroids, come and seek expert evaluation.
Men should not threaten women that, oh, if you don't give me some, so you will get fibroid. Don't
feel threatened, okay? Because it has no relation to that.
To that.
Yes. However, the only relationship I would say is in childbirth. Delay in conception exposes your uterus to those hormones, okay? And if you have a family inclination, you are prone to having fibroids.
The earliest someone should give birth is 25 to avoid?
I think it depends on what the person's things have changed nowadays. It depends, but would advise any age around 24, 25 and above.
24 and 25 and above would be ideal.
It would be ideal.
Your parting shots and your parting statement as we end this show.
Okay, my parting statement goes to two people. I want to talk first of all to our listeners, our viewers.
Yes, please.
Our viewers, thank you very much. You've been a wonderful audience. If you know you have been diagnosed with fibroids, you have a sister, your wife, please seek help. Don't shy. If you feel you have symptoms, you have things happening in your reproductive system, discharges, bleeding, fever, frequent UTIs, difficulty in conceiving, chest heaviness in the abdomen, backache, please come and see a trusted gynecologist. That is the information I have for our viewers. And please don't worry if you have been diagnosed with fibroids. There is hope. There are very many treatment modalities that we have not discussed here. And I want to pass this to my fellow health workers. The doctors out there, the obstetricians, the nurses, the midwives. We see these cases on a day-to-day basis. I personally see around 20. Yes, 20, almost 20 in a month. So let us not install fear in them. Let us help them understand the causes, because they will come with so many myths. And let us also understand the role of nutrition. It is of no shame If you are a midwife, you are a doctor, gynecologist, and you tell them the role, because it actually has a role. Most of our reproductive things have a role in nutrition. Let's understand the cause, that there is no specific cause of fibroids, but it is a collection of all those things, and that fibroids is heterogeneous. It has so many different causes, so many different angles, many different ways of managing it, and it has to be individualized. Don't say my mother was operated, I have to be operated. No. Don't say this one was given medicine, also give me medicine. It may not work for you. Let us individualize treatment according to the way the patient has presented themselves. Thank you.
Thank you very much, Doctor, and thank you very much for honoring our invitation. We have now duty to break down this very information to our Luganda audience. I hope you will still be available to help our local people understand this monster that we are battling with currently. Your girlfriend could be candidate, your wife could be candidate, anybody else could be candidate of fibroids. I want you to share this link so that we intensify the awareness against this monster called fibroids. At LC Africa, we are very much thankful for your viewership, subscription, and sharing. Please visit us. We are at Nansana, opposite KFC. Thank you very much. Until next time.
Mu mutima gwa Uganda mulimu ekimera ekyenjawulo era nga kijiddwamu omutindo ogusukkulumye. Eŋŋano ya Jiko nga ekolebwa ab'amaganjo grain millers. Kola ebyokulya eby'omulembe nga okozesa Jiko, owoomerwe ne famiri yo ne ku mikolo gyo. Yimusa omutindo gw'enfumba yo, oyimuse essanyu lyo nga okozesa eŋŋano ya Jiko. Ekolebwa ab'amaganjo grain millers. Eŋŋano ya Jiko evaamu ebyokulya ebiwooma nga byagalwa, woomerwa akaseera konna nga okozesa eŋŋano ya Jiko. Maganjo grain millers, feeding nations. Mu mutima gwa Uganda mulimu ekimera ekyenjawulo era nga kijiddwamu omutindo ogusukkulumye. Eŋŋano ya Jiko nga ekolebwa ab'amaganjo grain millers. Kola ebyokulya eby'omulembe nga okozesa Jiko, owoomerwe ne famiri yo ne ku mikolo gyo. Yimusa omutindo gw'enfumba yo, oyimuse essanyu lyo nga okozesa eŋŋano ya Jiko. Ekolebwa ab'amaganjo grain millers. Eŋŋano ya Jiko evaamu ebyokulya ebiwooma nga byagalwa, woomerwa akaseera konna nga okozesa eŋŋano ya Jiko. Maganjo grain millers,